Every single day in the United States, more than 200 people lose their lives to opioid overdoses. That's over 70,000 deaths every year. This epidemic has been called the worst drug crisis in American history. But how did we get here? What started as prescription medicine turned into a nationwide health emergency, devastating families, communities, and entire generations. Today, we'll uncover the truth behind the opioid crisis in America, the causes, the impact, and the fight to overcome it. What are opioids? Opioids are a class of drugs that include prescription painkillers like OxyContin, Vicodin, and morphine, as well as illegal drugs such as heroin. More recently, a synthetic opioid called fentanyl has emerged as the deadliest of them all, up to 50 times stronger than heroin. Doctors originally prescribed opioids to treat pain, especially after surgeries or injuries. At first glance, they seemed like a miracle, powerful, effective, and widely available. The rise of prescription painkillers. In the 1990s, pharmaceutical companies aggressively marketed opioids. They assured doctors that these drugs were safe and non-addictive. That statement couldn't have been further from the truth. Doctors began prescribing opioids in huge numbers. By the early 2000s, millions of Americans had bottles of these pills in their homes. Patients used them not only for pain, but also for stress, anxiety, even sleep. The result? A wave of addiction unlike anything the U.S. had seen before. Many didn't even realize they were addicted until it was too late. How addiction happens, but why are opioids so addictive? Here's the science. Opioids bind to receptors in the brain and release dopamine, the chemical that makes us feel pleasure and relief. Over time, the brain adapts. That means you need higher and higher doses to feel the same effect. And when the pills run out, many people turn to illegal alternatives like heroin, which are cheaper and easier to get. Eventually, fentanyl entered the scene, making overdoses even more deadly. Impact on American communities. The human cost of this crisis is staggering. Families torn apart. Children growing up without parents. Entire towns in states like West Virginia, Ohio, and Kentucky became epicenters of the epidemic. But this isn't just a rural problem anymore. Urban areas are also flooded with fentanyl. The economic impact? The opioid crisis has cost the U.S. hundreds of billions of dollars every year in healthcare, law enforcement, and lost productivity. Behind the numbers are real people, mothers, fathers, sons, and daughters. This crisis does not discriminate. It affects every race, class, and age group. Fentanyl, the deadliest chapter. Today, fentanyl has become the face of the opioid epidemic. Just 2 milligrams, about a few grains of salt, can be enough to cause death. The scariest part? Fentanyl is often mixed into other street drugs without people knowing. Cocaine, fake pills, even marijuana in some cases. That's why overdose deaths have skyrocketed in recent years, because people don't even know what they're retaking. Is there hope? Yes, the government has cracked down on overprescribing. Treatment options like methadone, Suboxone, and rehab programs are helping people recover. And perhaps most importantly, naloxone, known as Narcan, can reverse overdoses within minutes. It's being made more widely available in communities across the U.S., but treatment is just one part of the solution. Breaking the stigma around addiction and offering support is equally important. The opioid epidemic is not just about drugs. It's about people. What started as medicine turned into America's deadliest epidemic. If you or someone you know is struggling with opioid addiction, please seek help. Hotlines and resources are available because no one should fight this battle alone. This is a crisis we must face together, and awareness, compassion, and action are the first steps toward saving lives.